My name is Ben Squires. I'm an orthopaedic surgeon here at Musgrove Park Hospital, and I specialise in doing hip replacement surgery. Normally you need a hip replacement when your natural joint is worn out, and that happens when you get arthritis. The cartilage that lines this joint wears out so that the bone rubs against bone and it becomes painful and stiff, and that's often when we end up needing to do a hip replacement. This is the socket of the pelvis and this is the ball of the hip joint. When we do the hip joint, we fit in a new socket like this, and we cut this part of the bone off and pass the new hip down the femur bone, down here, like this.
Once you have been listed for a hip replacement, you will be asked to attend a pre-operative assessment clinic to be assessed by members of the nursing team. They will examine you and organise any tests needed to make sure you are healthy enough for an anaesthetic and surgery. At this appointment, you will be given a date for attending hip and knee school.
We will talk to you about the process you're going to go through from a physiotherapy, occupational therapy and nursing point of view after your surgery. At the group, you will be given advice on how to manage with your personal care and domestic needs.
On arrival the day of your surgery, you will be welcomed onto the ward and shown to your bed. You will be clerked in by the clinical nurse practitioner or ward doctor, and will then be admitted by a ward nurse. Your observations will be checked, for example blood pressure and heart rate.
Good morning, Mrs. Smith. My name is Mary, and I'm just going to put a little bit of monitoring on you before we start, okay? Now,
Before your surgery, you will be seen by the anaesthetist and your orthopaedic consultants team. Before going into theatre, you will receive either a general anaesthetic or a spinal epidural anaesthetic plus sedation, so you will be in a deep sleep and will not be aware of your operation. Once you have been anaesthetised, you will be taken into theatre where you will undergo the hip replacement procedure.
Mrs. Smith? Mrs. Smith? Hello? Your operation's all done.
After the operation, the nursing staff will monitor your condition and look after your needs.
If I just ask you to move your toes, have a go. Okay, now that's perfectly normal at this stage, and you've got 4 or 5 hours with it like that, but it means that your hip is lovely and comfortable. Alright, so no worries there.
The aim of physiotherapy following your surgery is to help you get going onto your feet as soon as possible. We're aiming to get you home by day 4. We will help you to be mobile, to be able to walk around independently.
Once you have returned to the wards and are medically stable, you will be assisted by staff to get out of bed. The physiotherapy team will teach you exercises and help you progress your mobility until you go home. You will be encouraged to mobilise by all members of the team, including physiotherapists, occupational therapists and nursing staff. It is normal initially to experience discomfort while walking and exercising, and your legs and feet may be swollen. The occupational therapy team will see if there are any problems with your activities of daily living and managing at home. You will usually be discharged between 2 and 4 days after surgery. Any stitches and clips that need removing will be done by a nurse 10 to 14 days after your operation. You will be followed up 6 weeks after your surgery by the consultants team in orthopaedic outpatients.